and recognize World Mental Health Day. And one of the things we've done this year at Howard Center is we've taken the opportunity to raise awareness by sharing this speaker series and other resources available to help to recognize World Mental Health and ensure people have access to care, which is of course critical in the work we do here at Howard Center every day. We're very much looking forward to Dr. Koutras's talk about exercise, leisure activities, and mental health in just a few minutes. But before we get started, we do want to say thank you to our sponsors for their support throughout this month. Our champion sponsors, Hannaford and Seventh Generation, our advocates, Blue Cross Blue Shield of Vermont and Marsh & McLennan, our supporters, Ben & Jerry's and Burton, and our allies, Invest EAP and Timberlane Dental. We also want to give a special shout out to our friends at Seventh Generation for their many months of volunteer support and helping us to plan. We do have a few housekeeping notes to review before we welcome Dr. Koutras. During the webinar, attendees' audio, video, and chat will not be available. Dr. Koutras will offer a Q&A session immediately following his talk, and you may ask questions throughout the webinar using the Q&A function at the bottom of your Zoom screen. Your questions may be asked anonymously, and of course, he'll work to answer as many questions as he can. We'll also be recording today's webinar, and we'll make it available at howardcenter.org in the next few days. And now I would like to welcome today's presenter, Dr. John Koutras. Dr. Koutras is the Mental Health and Substance Use Disorder Medical Director at Blue Cross Blue Shield of Vermont. He's also a clinical assistant professor at the Larner College of Medicine at the University of Vermont. And Dr. Koutras maintains a private practice in Burlington as a child, adolescent, and general adult psychiatrist. He's been really lovely to work with as we've been planning this session. And Dr. Koutras, it's obvious that you have many, many demands on your time, so we really want to extend our appreciation to you for taking the time to be with us today. So come join us.
Thank you for the introduction. Good morning, everyone. Thank you for joining us. So I'm going to be talking about exercise and mental health, and leisure activities do come in there, but it's a small amount of my talk, but I did want to highlight it in the program because it's important as we'll talk about at the end for later life, particularly. All right, so I also, it says here, so Vermont Collaborative Care. So I am medical director with Vermont Collaborative Care, which is, we're integrated into Blue Cross Blue Shield of Vermont. Before the pandemic, we were literally in the same offices, and we will be back in the same offices at some point in the future. So we're integrated right there with Blue Cross Blue Shield of Vermont, and I will talk about a little more about integration in a couple of slides. So I have no, in terms of my disclosures, I have no financial conflict of interest. As you can see, Blue Cross Blue Shield of Vermont is a sponsor, or I'm sorry, if I'm sure I got the level wrong, but at a certain level with Howard Center, and so that's, but I'm not involved in any of that, and of course that's not really a conflict of interest. So let's talk about the outline, just to give you an idea of how the rest of the talk will go. So I wanted to highlight, and I will in the next slide, this is a mental health talk regarding physical activity and exercise. And we will go into the definitions of the difference between physical activity and exercise, and then into physical activity section of the talk, where we're talking about wellness. And then we're going to have the couple of slides talking about some beneficial aspects to physical activity and exercise. So this is where we're going to talk about some potential mechanisms of action in how exercise and physical activity might be mediated by, and how we might have benefit for physical activity and exercise. And then we're going to go into exercise research. and the problematic areas within that research, and then exercise and mood and anxiety disorders, and that'll be the focus. And you'll see that depression is much more on depression than anxiety disorders, and then exercise and leisure activities in terms of cognitive function later in life, and dementia, and finally, just at the end, we'll talk a little bit about the pandemic. So the reason why I'm highlighting mental health is because, you know, this is going to be the content of this talk, that how this physical activity and exercise impact our overall wellness. How does it potentially impact even psychiatric disorders in terms of a treatment, a component of treatment? We are not going to be talking about other health issues. So regarding exercise, mobility, balance, strength, body mass, those types of issues. And frankly, those types of benefits to physical exercise, increased physical activity and exercise. But clearly integrated. So as one can imagine, if you're depressed, or let's say saddened. Recently, Michelle Obama even said that she was saddened somewhat she had a low-level depression because of the pandemic and increased feelings of isolation and so forth. You know, if that person finds, let's say, goes and finds a exercise group online, Zooming together, and they will have some improvement potentially in their mood. And also they will have other improvements. If their mood improves, which includes their concentration and ability to stay on task, they'll take care of their diabetes better. They'll be able to, should they trip, they'll be able to regain their balance and their strength and prevent a fall, for example, particularly in later life. So it's integrated. I'm separating it out here for the purposes of this talk, because I'm not a physiatrist or physical medicine rehabilitation doctor, and I'm a psychiatrist, and so my focus here will stay on mental health. But this definitely plays into it all other health issues, and it's a bidirectional relationship between other health issues and mental health issues. So, on to the definitions. So physical activity versus exercise. So what is physical activity? So physical activity is the amount of movement we get over a period of time, typically per week in a self-report. And we will go over the different types of activity that constitute physical activity, the different domains, intensity, etc. So that's physical activity. Exercise is more targeted, it's more specific. So exercise is a certain regimen that we do in order to have our strength improve, cardiovascular improvement, breathing, etc. So this is a specific exercise regimen. And in the studies that I'll be talking to you about, it's prescribed. So you're supposed to do an X amount of exercise every week for X amount of days. And that's what exercise is. So that's the difference. We'll start with physical activity. So physical activity domains. So physical activity occurs in life in different areas of our lives. So the one we focus on particularly is exercise that's intentional during leisure time. So things that we do to stay active, more active when we're not working. Or taking care of household work, chores, and so forth. So that's leisure time exercise. Work related, this varies so much between each type of occupation, and how much time you're sitting at a computer terminal and not exercising, or whatever else kind of more desk work you might be doing, versus a more active job. So that you get a lot of physical activity in just the nature of your work from day to day. Then we'll move on. Another type of domain is transport. So just walking around. So for people who live in Burlington, let's say, or in any other city in Vermont, you know, and they live within walking distances, they will walk more, just as a result of the ease of doing that. And you know, and this happens obviously in larger cities and so forth. That's transport. And then household, just what we end up doing around the house and how active we are, yard work, etc. So in this talk, I decided to include what the short form of the International Physical Activity Form looks like. And just to give you an idea of how this is even reported. So on item number 1, you could see it's vigorous physical activity, and they give you examples: lifting weights, digging, you know, aerobics, you know, fast bicycling, so fast movement in terms of walking in your arms and so forth, and then bicycling. So that would be vigorous, and then how often, how much time you spend per day, and amount of days per week. And this will give you an idea of more of what we're talking about in terms of transport, just the commuting type of physical activity, walking. So there's a difference here. Walking obviously is different expenditure of energy, different cardiovascular workout and so forth, from something that's more strenuous. So this form will gather this information fairly quickly, and obviously there's many other types of forms to assess physical activity. So what are the findings in terms of physical activity and wellness? So I start here with children and adolescents. So there's been much less research done on children and adolescents and physical activity than with adults, which, you know, it makes sense. Children and adolescents, you know, as you can see with a form like that, for example, you know, less likely to complete forms like that, less likely to overall engage, and also, frankly, you know, as we get older, we accumulate other illnesses and conditions. So that's where the focus of research has been primarily. But let's take a look at what we found for children and adolescents. So changes in appearance, self-perception, how they think they look, and so forth, ties into their self-esteem. So this is a positive outcome of physical activity. Increase in physical activity. What's interesting is it's not that clear in terms of social acceptance. So whether there's benefits in terms of social acceptance as a result of the improved self-esteem, less difficult to determine in studies. And then cognitive benefits. So the hope is there are cognitive benefits even at this age group, which is not prone to, you know, cognitive decline as when we get older. So, but it's been a little more challenging to drill down and prove the cognitive benefits. But some evidence does support that there's increased cognitive flexibility in problem solving in areas of the brain or activity levels in the brain that are more like adult patterns of activity levels when trying to do a task. So not enough research to draw any firm conclusions on this, but that's obviously would be a huge benefit. So moving on, obviously, as I said, a lot more research for adults, both in the physical activity that we're going to be talking about and in exercise as a prescription. So staying with physical activity, so what's been found is that a higher leisure amount of physical activity is associated with greater mental wellness. So not a work-related occupational type, not household, and not even with transport, but focusing on leisure activities. So, you know, the question one might have at this point is, well, which came first? The leisure time and leisure activity and the exercise as a result, or somebody's feeling better in general in terms of their mood and so forth, and so they're more likely to engage in such activities. What's the causation here? What's doing what? And for most evidence, and we'll talk about this again when we talk about exercise, it's one moment in time. It's what's called a cross-sectional look. And so that gives us less information as to which led to which. Mental wellness leading to more exercise, or more exercise leading to more better wellness, mental wellness. And the other thing I just want to say about the slide is that, again, we are not talking about other areas of physical activity where there are going to be benefits. So it's less clearly established overall mental wellness compared to other components of other physical wellness that these activity studies have demonstrated. So balance and things like that. Okay, so talking about the beneficial components, we're moving on to like a little bit of a diagram part of the talk. So the beneficial components of physical activity and exercise. So one way you could think about it is neurobiological, and then cognitive or psychological benefits, and social benefits. And this slide really helps to, from this talk by Lubins and colleagues, really helps to kind of put this in a schematic, in my opinion, so that we could use. So here's our physical activity. So exposure to physical activity, what the amount of physical activity, how strenuous it is, so the amount of workout you get with that physical activity, and even the context, which will be very important in terms of psychosocial. So is it a group activity? Is it a place where there's more likely for individuals to interact as a result of the activity? And then, of course, individual characteristics play into our physical activity and what we experience in physical activity, particularly fitness level, right? I mean, so it can be hard to initiate an exercise regimen. So these are proposed mechanisms. So one is the neurobiological hypothesis. So changes in the brain that can help with depressed mood, help with anxiety levels. And we'll talk about that in more detail in the next slide. That you can see, for example, here it talks about endorphins. So a lot's been made of endorphins, but kind of feel good, and endogenous means from your body. Opioids is a positive thing in this regard, to feel better. So, and that could be part of the feedback loop to you continuing to do a more strenuous workout. Psychosocial hypothesis. So we talked about physical self-perception and connectedness, and how even, if our mood improves, we're going to be even more likely to feel like we want to engage socially in a physical activity, in an exercise. And then the behavioral hypothesis. So one of the things one of the things that could moderate the effect of the exercise is how our sleep might improve as a result. So and that's actually one of my main recommendations to patients to improve their sleep, is to exercise some during the day, not late into the evening, but during the day, and their sleep cycle might very well improve as a result. And then here we're talking about cognitive functioning. Again, difficult to tease out, but we'll talk about that even more with late life cognitive functioning. Your self-esteem, your sense of mastery, of you're learning a way to exercise, and that's something that will make you feel like you're more able to take care of things, and feel better about how you are. And again, subjective and psychological well-being. I mean, there's a real connectedness here to these thought patterns that we develop, and how we are able to use exercise to get to be more relaxed, and cope with different stressors in life. And that, of course, leads to resilience. And here's where we're going to spend the last part of the talk, is on internalizing disorders, for lack of a better term, things like anxiety and depression, versus we're not going to be talking about externalizing disorders in this talk, conduct disorder, ADHD, and so forth. So this is from a pediatrics article, but which I see now I misspelled. Sorry about that. Pediatrics article, and so that's why there's some focus here on ADHD and conduct disorder. So, wouldn't it be nice if it's just if you get physical exercise, just like a bunch of rays of light like this going into your head? But that's not the way it goes. But the schematic, it's showing us what exercise can do. So it can do change some neurochemistry. These are neurotransmitter chemicals, serotonin, to feel better. Serotonin can then help with neurogenesis. Neurogenesis is, as you can see, is in the center here of this schematic. And really neurogenesis is our cells growing in different ways to interact in different ways and to be more able to change with situations, adaptability, and frankly, your mood has been linked to higher amounts of neurogenesis. This would show kind of in the hippocampal, what we call the hippocampal region. What is the hippocampal region neurogenesis been associated with? It's been associated actually with depression. So a certain percentage of depressed individuals will have lower serotonin, and this is a growth factor, brain-derived neurotrophic factor. These are some other growth factors here. They'll have lower levels of these if they're depressed. And lower levels of the neurotransmitters, and so there'll be less neurogenesis, and then creating a more persistent depressed state. And what will happen in these situations is their hormones will change, so they'll be under more stress, and so they'll have more release of steroids, glucocorticoids, from the adrenal glands and so forth, and so that also affects our ability for neurogenesis. So exercise changes some of these factors and decrease the stress hormones and allow more neurogenesis to occur between the growth factors and the decreased inhibition. So, so that's what we mean by some of these. There's been evidence for some of these growth factors and so forth through studies, and neurogenesis through rodent models for increased physical activity. Most of it happens at the beginning end, less of it happens as time goes on, but hopefully you stay well as a result of overall activity and following all your other health advice from your providers. So moving on to exercise. So again, exercise is a certain routine prescribed in these situations of research that you maintain for specific purposes of solely being active as opposed to work related and so forth. So the treatment group is not blinded to the intervention. So obviously, I mean, you know when you're exercising, right? You know when you're in the group that's exercising. It's not going to be something that you could actually, what we call blind, make the person unaware of. Are they receiving the treatment or not? This is also frankly true of most research around psychotherapy, right? That a lot of times they won't be blinded to the intervention. They just can't be. Whereas with the placebo medication and the placebo, it's much, much easier to do that in studies. Participants will overreport the amount of exercise that they do. So as they will overreport the amount of physical activity, they might score on those forms. So this will come into play a little bit when we talk about the evidence around a facilitator, an instructor, versus just do it yourself at home based on a set regimen that you're given for a study. Approximately 40% of the assessors in these studies are not blinded. In other words, they know whether you've been in the exercise group or not in the exercise group. This is problematic because they might be, especially the part of a research trial, and they're excited about this. They're thinking this is really going to help people. They might rate you as, if they're doing the rating, as improving more than if they didn't know which group you were in. And of course, that's definitely true of self-reports for people who are exercising, right? So again, they know what they're doing, so they hope for improvements. So when I say challenges, I mean the challenges of this research is knowing if something is really truly helpful statistically. The active group, the thing that you're using to change versus the control group, which is not getting the same treatment. So comparing types of exercise between studies, obviously these studies have different types of exercise in the active treatment group. So, you know, what are we comparing this study with this study? When we put the data together, you know, what are we really showing? Often there is the control group is a treatment as usual group. So they could be receiving antidepressants, they could be receiving psychotherapy. So they're getting these treatments. So they're not, it's not like they're not receiving treatment. Some are not, but others are. So it becomes, again, a challenge to prove that your exercise really added something to that. And how do you control for the social aspect if it's group exercise, which is fine. I mean, we'll know if an exercise has been helpful, and part of that could be the social aspect. But on the other hand, it also makes it somewhat confusing to compare studies to each other and add the data together. Because one study could be a prescription for what to do every week, and you're doing that by yourself for exercise. And then, and this is what gets to the last point, is professional instructor versus do-it-yourself. So the evidence in these studies points to the professional instructor actually, if it's group-led exercise through an instructor, the outcomes are better than if it's just do-it-yourself. Well, is that because of the instructor? Or is that because the person actually is doing the exercise? Remember what I said about over-reporting, as a result of being there and being somebody leading you and doing the exercise. Exercise types. So aerobic is high impact, low impact. You know, these are what we expect: jogging and sprinting versus cycling and swimming. Particularly swimming, you know, is a low impact aerobic exercise, and a really good one between for folks who are less able-bodied for whatever reason. Less, you know, ambulatory, etc. They could swim and exercise there. Resistance, weight training, and using body weight. So this is, you know, a different type of exercise, right? So it's not as aerobic, it's more resistant. And mind body type is breathing, meditation, progressive relaxation. And there's been studies to look at, I don't even know if I'm pronouncing it right, Huang and Tai Chi. So depression and exercise. So depression can affect up to 17% of throughout our lifetime of individuals. You know, the numbers vary, up to 10%, 17%. And there's a high percentage of individuals who have chronic depression, relapsing depression, who will have disability. So this is an area that is a lot of research and focus to help these individuals regain their overall cognition abilities and so forth by treating the depression. Most research has been done on exercise and depression. So that's where most of the studies are. So this 2017 meta-analysis included 35 clinical trials and almost 2,500 adults. So this is where most of the evidence, the data, is going to be on. Lack of comparison trials of treatment. So a lot of times it's the control group that we talked about, where they could, each side can be getting changes in medication, changes in therapy, and so forth. So we're not, usually these studies are not like, this group's going to start on a medication versus this group is going to start on an exercise regimen, and see how they improve and if they're comparable. Again, it's often added on with other treatments. So that can also be an issue in terms of really determining what's helping. The next, mild or moderate depression is, you know, especially if we're talking about just prescribing exercise as the intervention, you know, typically that's not going to happen with somebody who's severely depressed, suicidal, etc. So we'll have less data on that. So what's been found? What are the results? Exercise with depression has consistent positive effects. It's very helpful to a lot of people. It has moderate efficacy, which is actually very good. It seems that exercise is often helpful for depression. Now, I'm not saying it's going to put somebody into a remission state, where they're truly back to the way they were. We're talking about just improvements at this point, response, and there is pretty good response. Also, the studies show that the beneficial effects are higher in those diagnosed with major depressive disorder, as opposed to those who are reporting depressive symptoms. But if they truly meet the diagnosis of major depressive disorder, again, typically mild or moderate level severity, the beneficial effects will be easier to quantify and prove, which is actually very encouraging. That evidence is there. The beneficial effect is higher with an instructor, somebody who's leading the exercise group, as I mentioned, whether it's the fact that they're telling you how to do it best, or the fact that the person, the person's getting it because they literally have attended the session. I think it's difficult to tease that out. But if you take this data and you restrict it to trials where there's less likely to be bias, right? So again, where the person who's doing the assessment is not blinded to whether you got exercise or not. There are smaller effects. So that happens in every area essentially of clinical research. But it is important to keep that in mind, just in general in terms of evidence. But still, again, there's consistent positive effects. So again, some evidence for augmenting an insufficient response to pharmacotherapy. In this trial, the TREAD study, particularly in those who were not actively exercising at baseline. So if you remember back to that slide, which was the schematic, how much physical activity is a person doing at baseline. So for those who are not doing much at baseline, they had the best improvement in terms of adding an exercise routine to their current treatment for depression. And this gives you an idea of the amount of activity that was in this study. Late life depression. So this study in 2016 pulled data from 852 older adults, and they found that exercise significantly improved the depression. So they also improved, which is very important for this group that really need, their depression can affect their cognition even more than younger groups. And so it's and things like even eating and staying healthy that way. So important. Postpartum depression. So there's been evidence to support increasing physical activity during the pregnancy will lead to decreased rates of postpartum depression. So again, these are not to mean that it's truly preventative, it's just decreasing the rates. So exercise and depression, what are the recommendations? So National Institute for Health, Clinical Excellence, these are the recommendations. How definitive are they? Not very. This is from 2010. The thing is, they are a useful guideline to how much exercise. So 3 times a week, 10 to 14 weeks, low intensity exercise in this study. And then each week, a minimum of 150 minutes of moderate intensity, or 75 minutes of vigorous intensity, at least 25 minutes over 7 days a week. Several days, in a week. Anxiety and PTSD in exercise. So anxiety includes generalized anxiety disorder, panic disorder, specific phobias. There's less research for anxiety disorders. So remember, the research was 2,500 adults for depression, and here we have 262 adults. And that's the way research generally goes in psychiatry. There's much more focus on depressive disorders because it's difficult to be clear what group you have that the there's enough similarities between each person for anxiety disorders. So it's a more challenging research area. But what this showed, this meta-analysis, is moderate efficacy for this group for anxiety disorders. Post-traumatic stress disorder, only a few studies actually in this meta-analysis, they were included in there, showed some moderate efficacy. What happened with DSM, with the Diagnostic and Statistical Manual for Psychiatry, is that PTSD was no longer called an anxiety disorder. It's a fear-based disorder. So that's why it's separate here. But anyway, not enough research into that area with exercise. Physical activity and exercise during the pandemic. So, well, there's decreased daily activity levels for a lot of people. People who are, unfortunately not working, or they are working and are working from home. So they have decreased activity levels and they have decreased socialization. So that's all age groups, kids, adults. Really, the hardest hit is older adults who are at more risk for complications if they contract COVID. So again, a lot of decrease in socialization. Child and adolescents, decrease in sports, which makes exercising more fun. And they're not getting, because they're not participating in sports as much, sports are going on, but still less than usual. So then you have to think about, how do we add in some activity for children and adolescents? And that's challenging. Because they're not with other kids. I wish I had a great answer to that. There's some video games that, like the Wii and so forth, that like there's physical activity in them. They can make things more fun, but really in getting kids outside as much as possible. And adults have been exercising outside a lot more. And it's interesting, bicycle sales, for example, bicycles became super popular. And there's some evidence that also shows that some aspects of better wellness with outside exercise and being connected more to the environment. Exercise, leisure activities, and dementia. So what's been found is a moderate to higher intensity exercise in midlife and with aging as a result of an improved cognitive functioning later in life. There's payoffs down the road. And then increase engaging in active leisure activity in older adults has been protective for impaired cognition with aging, even more than the educational level they've attained. A lot's been said about, how engaging was the work you did. What level of school did you complete? A lot of things that have been helpful to keep your skills, increase your skills cognitively. But really, it looks in this study, the amount of leisure activities you engaged in as older adults after retirement and so forth is more protective than any of that. And this could also, of course, speak to socioeconomic status. So if you have more income that you could spend on some other activities, leisure activities, but then that obviously plays in this as well, but doesn't have to. Take-home message from all these studies the messages are: professional instructor guided exercise seems to be more efficacious in these studies, and there's a lot of reasons to that. Today with the pandemic, it's getting harder to do that, but you can do that through Zoom to exercise together. It's getting colder out, but exercising outside together. And anyway, it's best if there's an instructor involved, but again, we don't know if that's because they're more adherent to an exercise regimen, or if it's just that kind of level of instruction is more helpful, but we're gonna err on the side of saying it's more helpful. Increasing leisure type exercise, like we talked about, that seems to be more impacting on wellness than overall physical activity level. Increasing more strenuous exercise. So the studies have shown that. So increasing the strenuous exercise will be more helpful overall in terms of wellness and improving your mood and protective for cognitive decline later in life. Aerobic exercise component has been shown that it's better than the resistance type of exercise that I've been talking about in terms of overall wellness, depression, and cognitive abilities. And mindfulness component can also be very helpful. We didn't talk about that as much in this talk, but those kinds of exercise, there's been some evidence, for example, with older adults, that combining that with an aerobic part, so walking plus a mindfulness kind of approach to helps more by combining them than just having one or the other. And then outdoor exercise, again, connect more with your environment. Thank you, everyone. That's the end of my talk. We'll answer some questions. Are certain types of exercise better for mental health than others? Right. So that's a great question. And I did basically just end on that. There's been also studies that have shown that combining aerobic exercise with resistance training is even more beneficial in terms of mental health. Okay, yeah. Real issue here is gyms. Gyms have been closed and they're reopened, but you have to schedule your time to go in there now, and there's going to be more concerns. This person is worried, how will I maintain my exercise level with the winter coming on if I don't want to go to a gym because I'm concerned about contracting COVID at the gym. So and then the question at the end is, if my mental health does take a hit, when do I know to reach out for help? Well, I will say, doing activities as much as you can outside is and wearing the clothing and so forth to tolerate the colder weather, is definitely the way to go if you can. And then when you can't, connecting maybe to some sort of Zoom, some sort of activity online that's guided exercise. Could be really helpful. And I mean, I have not explored all these options, but I'm sure there are options there to do that. Even things like yoga and so forth, the mindfulness type work, or something like aerobics type exercise. So and in terms of, when you're doing worse, when everything seems negative, where everything seems stressful or overwhelming and so forth. So when your anxiety gets high and your mood gets low. Are there adjustments to the National Institute for Health and Clinical Excellence exercise duration and intensity for older adults? Excellent question. So not that I'm aware of, and in fact, these guidelines were discussed also within the context of an older adult study. So the thing is, what you do for strenuous exercise might be different based on how you're doing. So trying to push your walking to be faster as opposed to when you're younger, doing sprints, that kind of thing. But so what constitutes strenuous exercise will change across age, but the rest in terms of time and frequency during the week is the same. John, you seem like a pretty busy man. What do you do for physical activity exercise program? When do you find the time? Okay, so I take out my bike. As you said, winter is going to be rougher. And also I do run some. So that's what I do for activity and exercise. Also, I mean, the issue we didn't talk about is days are getting shorter. So it's even harder to do that stuff outside, especially if you work during the day. So yes, and so the next question is there any correlation between economic status and the relationship between activity, exercise, and mental health benefits? And I alluded to that. Yes, the question is how much is it socioeconomic status versus getting only your activity through occupational, which we said people with the wellness is not as high, and not having leisure time to exercise more, which again contributes to better wellness. So that's an excellent question, and we did talk about it at the end in terms of just the overall leisure activities and having, post, when you're retired, having enough resources for that. Could you speak more as to how exercise improves mental health and brain function? So yeah, we talked about that a bit. Certain neurotransmitters increasing like serotonin and growth factors increasing that contribute to neurogenesis or new nerve connections and growth. Yeah, so how do you encourage physical activities with being outdoors with teens who would rather hang out inside watching movies or on their iPhone? It's a huge issue. Pokemon Go got people, and it's been studies to show that it's got kids outside more and teenagers. So there could be an app, a game that will get them to go outside more and continue to use their phone. So make it more fun and interesting. So I'm sure there are others that they can explore. So you can kind of meet them halfway with that. Thank you for all of you for your compliments too, by the way. I very much appreciate them. Yes, and neurogenesis, and I just said what it was because I also realized I didn't say it's a term for nerve growth. So thank you for asking that. My kids are in 6th, 7th, and 11th grade. All of them really like playing video games. Some of the games are really violent. So my husband's fine with this, but I'm concerned that the games will make my kids unstable. Are video games bad for mental health? Are there any video games that could be good for mental health? So we talked a little bit about the Wii games that keep you more physically active, Pokemon Go on a phone, keep you more physically active. Yeah, there's a lot of question marks with violent video games. It's been difficult to prove connections to actual aggression and violence. But the industry has also sponsored studies to say the contrary, that with the violent video games emerging in the 1990s and more realistic, and also violent crime decreased. So anyway, a lot of interesting stuff there. Great. That seems to be all the questions. Oh wait, no, there's a few more. Yeah, so recommendations for anxiety. I mean, I would just take the same ones for depression. The interesting thing about this stuff is, your anxiety will improve, particularly around the exercise and less so later on. If you stop, by the way, exercise, the beneficial effects wear off. You stop having them. So that's the main thing. I wouldn't say there's clearly a set amount, but follow those general guidelines. Try to make it multiple days a week. I mean, you have to meet the guidelines, but and a period of time. Try to increase the strenuous level of it, so long as you've spoken with your primary care provider about this. That's really important if you're older, is to do this with under the supervision of your primary care provider. So does the evidence support exercise every day of the week or more strenuous exercise a couple of days a week? And I would say the benefit is more that if you do it multiple days a week. Especially for a metabolic level. Increasing your metabolism, decreasing the likelihood of weight gain, is multiple times a week, because really your metabolism goes up during that time. Again, I'm not a physiatrist or an endocrinologist, but, so, okay. All right, and I addressed the last question. So I think that's pretty much it for the talk.
Dr. Koutras, thank you very much. Here's a round of applause from all of us to you. Really appreciate you're putting time and effort into putting this all together. The research was great. I know as a midlifer, I'm going to continue exercising in the hope that my older life will be better and improve. Thanks to everyone for coming. We will be sending an email out shortly, and would really very much appreciate your taking the time to fill out our feedback survey. That will help us in planning for our winter spring series, which we'll let you all know about as soon as that has been scheduled. And just FYI, there's resources available at howardcenter.org, and all of the recordings from our past 3 sessions and this session will be there. The past 3 are already up, and this session will be up within a day or 2. Also, just a reminder, I know there was one question in the Q&A about accessing help. First Call for Chittenden County is available 24/7, Howard Center's crisis program, and our main number, Access and Intake, is also available. I'll just, First Call for Chittenden County is 488-7777. And our Access and Intake and main number is 488-6000. So thanks again. Please take good care of yourselves, your family, friends, and colleagues over these coming months. Be well. Thank you.
Thank you.